Well, good afternoon. This morning, we woke up to the news about the tragic crash of a Canadian Armed Forces helicopter off the coast of Greece. My thoughts and prayers are with the families and loved ones of those brave servicemen and women. God bless them all. I want to start by addressing something head on. I know how much people want to get back to work, how much we all want to get back to normal. I hear it, I see it, and I feel it. I know how hard this period has been. I feel your grief for the lives you have lost. I feel your frustration in the face of this enemy. I feel your anxiety about what the future will bring. But I want you to know that despite everything, despite the hardships we have endured, despite the uncertainty ahead of us, despite it all, we have many reasons to be optimistic right now. We have taken a measured approach. We, as a province, 14.5 million people, have taken this fight seriously. We have thrown everything we have at this virus. And because of that, because of you, we have made tremendous progress. Today, we're on the path to reopening the economy because that curve is flattening. That surge in our hospitals, we avoided it. And that trend is going down. There's a light at the end of the tunnel. And I am laser focused right now on opening things up as quickly as we can in a safe and measured way. We will open things up in phases as it becomes safe to do so, based on health and science. And on Monday, we laid out our roadmap. We have a process. We have a clear criteria and targets for reopening. And as the trends keep going in the right direction, as we get closer to the targets we need to hit, as we get closer and closer to opening up, today we are giving businesses and workplaces the best guidance available on how to open up safely. Today, we're telling our businesses how to be ready for when we get that green light. We've been working closely with Ontario's health and safety associations. Together, we have developed over 65 sector-specific guidelines for Ontario workplaces. They include guidelines for workers in healthcare, retail, the automotive sector, manufacturing, food processing, tourism and hospitality, restaurant and food service, our agricultural sector, office workers, transit, transportation, and utilities. We have guidelines for the construction sector to promote better sanitation and physical distancing on job sites. And in the coming weeks, we will continue to provide updated advice to protect even more sectors of our economy. These guidelines will help Ontario businesses adapt to the new reality we face and keep workers and customers safe. All of these guidelines, taken together with our framework, provide a strong foundation to help us get the province working again. My friends, this pandemic has turned our lives upside down. It has put our will and our resolve to the test. But we are winning this fight, and we will win this fight. And Ontario will come out of this stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll turn it over to Minister McNaughton.
Good afternoon, everyone. The vast majority of essential businesses in this province are doing an amazing job under very, very trying circumstances. There are hundreds of thousands, if not millions, of unsung heroes who continue to go to work each day to get their jobs done so that the rest of us are safe. Employers are doing a good job, but we have to do better. and this is important now, and will be just as important as our economy begins to reopen. In that spirit, today I'm announcing an additional 58 people will be joining our provincial labour inspectors. They'll be starting this week. Some of the new inspectors will focus on communicating COVID-19 safety guidelines like the ones the Premier just spoke about to essential workplaces. Others will enforce emergency measures. This includes physical distancing on job sites and the closure of non-essential businesses. If you're not doing a good job of promoting distancing, the inspectors will help you correct that. Eventually, if you're not doing a good enough job, you'll get fined. Our inspectors have the power to issue $750 fines in accordance with the province's emergency measures. We're giving you a lot of good information here today. The Premier just mentioned a few practical tips. Our guidelines have many more, like adding markings and barriers to manage traffic flow, like managing traffic on work sites, and restricting the number of people on site at any one time. There are now more than 60 guidelines. You can find them, along with the helpful work posters on a new job on the Ontario government website, ontario.ca/coronavirus. We are doing everything in our power to ensure workers are safe because we want to protect people and because safety is an economic issue. We need to do this right to ensure our reopening, when it comes, works for everyone. Thank you.
We'll go to questions. First question.
First question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier.
Hi, Haley.
Is it time for your government perhaps to mandate auto insurance companies to significantly reduce rates? Because listener after listener of ours are telling us that their companies aren't offering any reductions, and in the few cases that are, they're only offering a couple of dollars off a month.
Well, I've had this conversation with the finance minister, and I know he's in conversations with the large insurance companies, but a message to the insurance companies: lower your rates. People aren't driving as much. You know, that's my message to them. They have to lower their rates because, again, people aren't driving. The risks to the insurance companies are much lower, but you keep taking their checks. Start lowering the rates for these people. We're hurting, but you need to pitch in too.
Follow up?
Sorry.
And my follow-up question, would you consider splitting Toronto from the rest of the province in terms of loosening restrictions? Because I'm sure businesses in smaller towns and cities are wondering why they're still shut down when the numbers where they live are much lower compared to somewhere like Toronto.
Yeah, good question. We have this conversation constantly amongst caucus, amongst the cabinet, and when I talk to municipalities and rural mayors. The problem is there is no border around Toronto, around the GTA, and sure enough, if you open up in a rural area, a lot of people are just going to head up there and go into these rural areas. We have to do it as a province all together. We do see some good results, some positive results in the public domain, and as I've always said, there's two worlds right now: is the long-term care world, and then there's the public domain. In the public domain, we're seeing very positive results, and that's why the Minister of Labour have laid out the guidelines. I want companies to start getting ready. We're getting close. I'm giving you hope. We are getting close. Get ready. And based, again, I'm always going to say this, based on health and science. We need to continue seeing the curve flatten. We need to see the numbers continue to go down, not just for a few days, but for a couple weeks. But the reason we're throwing out these guidelines, there's a reason. Get ready. We're going to get things moving.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
You're striking a much different tone than you did just on Monday when, you basically said you won't be rushed into reopening the economy, that health and safety are the priority. I know you just said that, but you're sounding much more on the path to reopening the economy today, saying companies have to get ready. So what has changed in the past few days? Have you been hearing from businesses frustration, anger perhaps, that Ontario did not provide enough details when you released the roadmap earlier this week?
No, actually, I haven't. And what I'm telling people, get ready. It doesn't happen overnight. These companies are going to take a little while to get the guidelines in place. They're going to take a little while to make sure they have the proper structures in place. I'm feeling more positive over the last 4 or 5 days. You get the odd spike as we've seen, but over the last 4 or 5 days, we've seen more positive results. And Laura, as everyone has seen, this changes day by day by day. But we have to make sure that we're prepared. Monte has been working, Minister McNaughton has been working on these guidelines over the last couple of weeks, knowing the day is going to come. But we just can't throw out the guidelines and expect people to open up overnight. This is a clear indication that the time is coming sooner, and we're going to get there. And I just want people to be prepared. There's 60 to 65 guidelines, and then, by the way, that's going to continue to grow as we move to make sure that companies are ready until there's no reason people won't be ready, and making sure we have a secure, safe work environment. That is the #1 concern, making sure employees are safe.
And we're also hearing about a personal support worker, Arlene Reed, who her family says died after contracting COVID-19. Her family also expressed some concerns that she was concerned about not having adequate PPE and that she felt pressure to return to work. So I'm wondering if you can address this, Premier, and perhaps Minister McNaughton, about the pressure that some of these essential workers are facing by their employers to get back to work, and what they should be doing in those situations when they have to look out for their own health as well.
Well, first of all, my condolences and my prayers and thoughts go out to all families that lost loved ones. It's a tragedy. But we have said over and over again, anytime a long-term care home feels that they need PPE, they call. They all have the number. They call within 24 hours. We have people, Laura, sitting there waiting for calls from long-term care. And once they call us, within 24 hours, they're getting PPE. And we're on it right now. We have the PPE. All they have to call, and if they can call anytime, even Saturday, Sunday, whenever, if they notice they're running out.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Experts and epidemiologists seem to agree that before you open up the economy, there must be random testing in the community to create a baseline, and then test every couple of weeks after to see how opening up the economy is impacting the potential spread of COVID-19. Have you considered doing that? Will you push for that type of testing? And if not, why not?
If I can pass that over to the Minister of Health.
Well, yes, that is a very important factor in terms of opening up the economy. That was indicated by Dr. Williams, our Chief Medical Officer of Health, that first of all, we need to see a downward trend in terms of the number of cases. And we are starting to see that. There was a bit of a bump today, but we can expect that as time goes on. The most important thing is we are headed in the right direction. We also need to make sure that we can expand our testing. We are doing that, but we also need to, we have the public health capacity in terms of capacity of our hospitals. But the final piece is that surveillance in the community. That is going to be really important for us, especially when we are in a position to start opening up parts of the economy, to make sure that we don't see outbreaks in any particular areas. If we do that, then we may need to reconsider some of the measures, but the surveillance is going to be really very important as time goes on to check for any outbreaks in cases, to check to see immunities with some of the antibody tests. So we are working on all of those factors right now. That's going to be essential as we do and when we are able to open up the economy.
Thank you, Minister. And Premier, my next question is for you. My colleague Pam Cedar is working on a story, gardening centers. They're very concerned because they have a narrow window to sell plants
that have a small lifespan and need to get into the ground.
Yes.
Do you have any sense of when you might open up gardening centers? And not to mention the fact that people need something to do, and for many it's mental health.
I agree 100% with you, and good news is coming very, very, very shortly. That's what I can say right now. But I agree, nothing is better, than going to the garden center, grabbing some plants, going in the backyard and planting the flowers. I said the same thing at Cadna. It's good for mental health. It gets people outside, and a lot of people are avid gardeners. I know my parents were, and we do at our own house. But we need to get going. So just stay tuned. Good news is coming for the garden centers.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi, Allison.
I'm sure you've seen the news out of Ottawa that the city had asked its nursing homes to tell families to stop doing these window visits. Jim Watson has since come out and told them to essentially rethink that. But I wanted to get your take on that, especially given that that's how your family has been visiting your mother-in-law.
Mm-hmm. I'm trying to be politically correct, but I'm usually not politically correct. That's ridiculous. That's ridiculous. You have a loved one, at a home, and most of them are elderly, and the last time you get to see your parents in some cases, I don't know who's come up with this ridiculous idea, but they need to rethink it. Put yourself in their shoes. When our family goes to visit my mother-in-law, do you know what I think? I think, thank God she's on the first floor. And there's people that go on the first floor. How about if you have your loved one on the second floor or the third floor? Imagine how heartbreaking that is. You have your mom or your dad or your grandparents up there, and they're wondering what is going on. A lot of them are very confused on why isn't my loved one, why isn't my son or daughter coming to see me? So it puts them in a real state of confusion. But not to be allowed to go look at your loved one through a window and give them a kiss or put your hand up on the window. That's just wrong. They got to think these things through. Go visit your loved ones. As far as I'm concerned, this is critical, and hopefully it won't be the last time you see them. I'd go to the window.
Follow up.
Thank you, Premier. My follow-up is probably best directed to Minister McNaughton. The guidelines that are released today for businesses just coming out now, so we haven't had a chance to look through them yet, but you mentioned things like physical distancing, barriers, markings. Is there anything in these guidelines that's going to be mandated for businesses as they reopen?
Well, certainly these are best practices that businesses should be following across the province. We've announced today about 65 guidelines for different sectors of the economy to follow, as well as the enhancement of 58 additional inspectors. That brings the total number to about 500. And we expect that businesses will follow these best practices. It's important for these businesses, obviously, to have their workers come back and show up when those specific businesses open. But it's also, as I said in the beginning, it's an economic issue because these businesses need customers coming in their doors as well. So we would anticipate that businesses will follow these best practices, and our inspectors will be out proactively communicating on how to implement these, and at some point they'll be enforcing a number of measures in the Occupational Health and Safety Act.
Next question.
Next question comes from Antonella Artuso from the Toronto Sun. Please go ahead.
Thank you. Good afternoon. This is a question for Health Minister Christine Elliott, please. I wanted to ask about elective surgeries. Is there a framework in place to resume elective surgeries and procedures? And if that's the case, will it be gradual? And will some procedures be prioritized over others?
Well, there will be some that are going to be prioritized over others based on the needs of the patient. And I would say that cancer surgeries, cardiac surgeries would be among the first. But there are also orthopedic surgeries. There are people that are having difficulty walking. They need hip or knee replacements. But yes, we are putting a process in place to start elective surgeries as soon as possible. There are some issues that relate to that require thinking about. One is the fact that there are many hospital personnel who have now been redeployed to long-term care centers to help them deal with the COVID crisis that they're facing. There are some drug issues that we need to make sure that we're going to have the necessary sedation drugs and other drugs for surgeries. There is personal protective equipment as well that we need to make sure that each hospital that's going to be deploying that type of surgery will have their own personal protective equipment and will be able to rely on that rather than taking it from that pandemic stock. And then, of course, there are some hospitals that have a very high number of COVID-19 patients. So as we start doing elective surgeries, we may need to redeploy some of the surgeons from one hospital to another and the patients from one hospital to another where they can do that surgery safely. So all of these issues are being taken into consideration as part of the process and the plan for resuming elective surgery. So our command table is working on that quite diligently. We expect to have more to report to you early next week on this issue.
Thank you. Your government provided $300 million in part to create quite a bit of surge capacity in the hospital in terms of hospital beds, I believe about 3,000. Are you intending to leave those beds in place to help deal with what is a backlog in elective surgeries? And at the end of this, or do you expect that backlogs for things like hips and knees, which may be a little lower on the priority list, that backlog will grow?
Well, of course, we're worried about backlogs growing for all types of surgeries. That's why we know it's important to get back to these surgeries as soon as possible. And yes, we are going to keep the beds open that have been created during this capacity change to make sure that we had more hospital beds. But some of the additional beds also were going to be created in specific locations if we had outbreaks there. So while there is a plan to create field hospitals or to use space in hotels or community centers, whatever it was, we haven't proceeded with that on the basis that we're very fortunate that we haven't needed that additional capacity thanks to the efforts of all 14.5 million Ontarians who've made the difference here. So there are some spaces that aren't going to be built to deal with that, but we still do have ample space in many of our hospitals to be able to start these surgeries once all of those other issues have been dealt with.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier.
Hi, Lisa.
Overall, the number of deaths in long-term care homes has continued to rise. It's up by about 60% from. Why hasn't the province been able to contain the spread of COVID-19 in these homes yet?
Well, we're throwing every single resource at these homes. And, you know, it depends if you look at the percentage. You know, we're focusing on they have them in categories, red, you know, yellow and green, but we're throwing every resource we can to make sure that we help the people in these long-term care homes, no matter if it's transferring staff from the hospitals or bringing in the military. It's all hands on deck. And we're going to continue. We aren't going to stop. We're going to focus on long-term care. That's the hot spot right now.
Thanks very much. And it's still on testing. It seems like we're still just inching up in the number of tests being done in the province. Is this delaying Ontario's ability to relax some confinement measures?
Well, the day was May the 1st is the 14,000, or actually I think it was the 29th, but they fell short just by 1,000 yesterday. They promised, believe me, I was all over it this morning. They absolutely promised it's going to be over 14,000 tomorrow and moving forward. But we don't want to just stop at 14,000. We want to continue to expand these tests to our absolute maximum. and we're going to continue doing that. So I was on that first thing this morning when we see that we fell about 1,000 short. But I do want to say I do have confidence in our health team. They're going to get out there. They're moving forward. And if you compare it up to 4 weeks ago, we're barely doing 3,000, and now we're almost 13,000, and moving forward it'll be over 14,000 and continue to grow. But I'll tell you one thing: I'm like a dog on a bone on this, and I will not let go for a second, not for a second. And every single day, as I'm being held accountable, we're all going to be held accountable, and the health team as well.
Next question.
Next question comes from Sabrina Nanji from Queensburg Today. Please go ahead.
Hi, Sabrina.
Hi, Premier.
Hi.
I'm hearing from small businesses that are worried about making rent because their landlords aren't opting into the federal provincial assistance program. I know you're working with the feds for more relief, but you've been the Premier who's all about helping small businesses. Is it time for you to step in and declare a moratorium on commercial evictions?
Well, right now, we worked with the federal government. We put over $900 million, almost close to $1 billion towards this program. And that should help a lot of people. And I'd have to find out the exact cases about the landlords, but I think it's a pretty attractive deal if you're looking at, again, the landlord will have to take a hit, and the people that are the small business that's using their facility or paying rent, the renters per se, they're going to pay 25%. Federal government's paying 25%, and the province is paying 25%. So we're doing everything we can. We're throwing a lot of money at it, and hopefully that will help them get started. But that all goes back to my first comments. We have to get the economy going based on health and science. We aren't going to rush into it, but I have to make sure that there's hope, put out the guidelines, get ready, guys. When we get that green light from the Chief Medical Officer and our health team to move forward, we're moving. And the quicker we can get things on the move, the quicker we can resolve some of these issues. But in saying that, we've thrown almost $1 billion at supporting businesses. Also, the people that own these businesses on childcare, we're taking care of the childcare. We're reducing electricity rates as well. So we're trying to help people as much as possible.
Thank you. BC's top doc is saying that people should feel comfortable being outside, and there's a low risk of getting infected from someone walking past you, even within 6 feet. That's not what we've been hearing here in Ontario. Have you asked the command table to look into this, and has there been a change in their direction?
Well, we have, and it's all based on the numbers. That's what it comes down to. As we see the curves flattening, there's more hope, and that's what I'm telling people today. There is hope. There's some positive results, and just hang in there for a little bit longer. We've worked this hard. We've come this long, this far, and we're almost there. So just hang in there, and we're going to get there collectively, all of us. We're going to get there. I feel it. I feel positive.
Okay, that's all the time we have. Thank you.
Okay, thank you, everyone. Have a good day.